causes for CP, what are the pathophysiology, what are the types. We are going to see another type. Which one is mixed CP? The mixed CP may be of spastic or ataxic, spastic or athetoid, or ataxic or athetoid. It may be a combination of any two of the CPs. It may be a combination of any two of the another two CP. Mostly it is of the spastic and ataxic. There was a child when we are going for posting, when we are studying, when I was studying in my college, there was a CP child. He is very active. He is around 14 years. 14 years old boy. He comes to the college every day, college OPD every day, and gets the treatment from 9 o'clock to 12:30. He undergoes various type of the treatments. I will explain it later. Then we go for the another type of the types. It is divided by which part it is affected. So basically you will say the child will be the quadriplegic spastic CP or spastic quadriplegic CP. What is meant by monoplegic? A single limb involvement. What is meant by diplegic? It is a two limb involvement. What is meant by triplegic? Three limbs, either maybe of the two lower limbs and one upper limb. And if it is paraplegic, maybe of two limbs or maybe of the half quarter of the body. Then hemiplegic, one side of the body. Quadriplegia, all four limbs will get for affected. So what is here? The baby can't able to move a limb or can't able to move both or more than one limbs. It coming under these steps. Good. How we check those? How we investigate the CP child? We can investigate the CP child from the birth onwards. From the birth, how we are analyzing the CP? Delayed birth cry. Hypoxia. Baby goes for hypoxia. If the hypoxia is happening, the brain won't get any oxygen, so it leads to CP. Then the baby get any hit in the brain. Then the genetic factor come upon the baby, it will lead to CP. We can investigate that in the brain changes. Brain have to grow by age. We have to check the brain by MRI or the PET scan. The basal ganglia, how the basal ganglia is being grown. And another way we can check the baby is having a cerebral palsy. How? What is the way? Our grandmas will see after 3 months the baby have to extend his or her neck, which means tala nikkanum solluvom. The baby has to hold his or her neck, his or her head. Head have to be in a neutral position when the baby is lifted up. So if the baby can't able to lift it, it will shows clearly baby is having a delayed developmental milestone. The delayed developmental milestone means the baby have to do certain things in certain months of the age. 3 months the baby have to hold his or her neck. 6 months the baby have to sit erect position. 9 to 12 months the baby have to stand, and after the 12 months, 1 year of the age, the baby starts to walk in that period. If the baby is delayed in these milestones, if any of the neonatal reflexes is persisting being after 1 year, like your sucking reflex, rooting reflex, grasping reflex, Babinski's sign, I already said some of the reflexes. Do you remember that? The Babinski sign, which we scratch from the lateral side of the leg, the baby will do a flexor movement. If the baby is doing the extensor movement, the Babinski sign goes for next stage, so the baby can be able to walk. It should be like this when you are doing a Babinski sign, Babinski reflex for an adult. If it is for baby will flex it. If you are going to give a hand near, give your finger near to a baby's hand, the baby will grasp it. It is called as grasping reflex. It will go for 3 to 6 months. After 6 reflexes, we can check from the baby's side. Then from the investigation of MRI, we can conclude that baby is having cerebral palsy according to the development of the basal ganglia. Then after that, we are going to the genetic part. If there is a genetic disorder, we can find it out by any genetic test which have been made. Okay, the baby is diagnosed with the genetic disorder, the baby is diagnosed with the spastic CP or any of the types of CP. What are the treatment you are going to do to that baby? We will see next.